gonna start an IV, and I'm gonna verbalize the 6 rights of medication administration, which are right patient, right drug, right dose, right route, right time, and right documentation. And then I am going to hand hygiene. Then I'm gonna check the MAR and the orders, make sure that I've got the right solution, the right amount. Yeah, then I'm gonna check it for particulates, expiration date, and cracks, everything looks good. I'm also gonna check the MAR for the infusion time, for the order, sorry. And then I am going to select the right needle for the patient and the solution. And I am going to check the patient identifiers. IV needle, I don't know what her birthday is. And then just make sure they know why they're getting the IV and make sure they're in a comfortable position. Label it, which I've already labeled it here, with the patient name, the date, and my initials. And then I would label it again with the infusion rate, when I started it, and then when I expect it to end, which will be 6 hours from now. And then, so the infusion rate is 12 drops a minute. Take this out. There's the clamp. And I don't actually know how to use this kind of thing. Can you pull this off?
Yeah.
Oh, okay. All right, then I'm gonna spike it, maintaining sterility. And okay, that was supposed to be halfway. Prime tubing. Maybe. Place my tourniquet. I always do this backwards. My hand there. And then I'm gonna palpate for a pulse. It's got a pulse. Loosen it and reapply. Okay, and then I'm gonna locate a vein, the most distal, and make sure it's got a nice rebound. Looks good. Take this off, and then make sure I've got my supplies. I've got my 20 gauge needle, alcohol pads. I've got my saline lock on there already. Tegaderm, tape, and if he was really hairy, I would trim the hair. All right, okay. Wrong way. It's like every time. Okay. Clean it. I didn't get my gloves. Sammy's gonna go grab my gloves right now. That's what Sammy's gonna do. It's my job. It's my job. Good thing I have my assistant here tonight. Okay. I better switch out my blood bags too, or else my hand's not gonna bleed. Okay, hand. Feel a pinch. Is the hand working? Is it open? Okay. Take out the tourniquet, pressure, attach the lock, and flush it with 3 ml. It's really hard on the hand. Okay, well anyways, I flushed it because it doesn't want to go in there. Okay. Okay, and then initial date and time, whatever the date is. Okay. And then I've got my gauze. This isn't really a 2x2, but it's gonna work for now. Kinda hard with the really big gauze. So thick. Okay, all right. Ta-da. Right. Okay, I'm gonna attach that and make sure I am keeping sterility. And then take this up here, sort of. That's a good taping job. Okay, and then I've got my predetermined drop rates. So I would count over 2 minutes. I'm not gonna do that for the sake of time, but you know, I would do that. And then I am going to lower the bed, make sure their collie is in reach, make sure they're comfortable. And then I'm gonna document the site, noting that there was no swelling, redness, patient reaction, the gauge of needle, what was infused. So throughout the whole process, I would be checking the line, checking the rate of flow every hour, checking the site, making sure there's no bleeding, phlebitis, no kinking.